Good morning, good afternoon, good evening. It depends on your country zone, wherever you are. Are you in Uganda? Are you in other parts of Africa? Or you are in Europe or in America? I greet you wherever you are. It is your friend, Royal Mark again. Now, have you been confused, disturbed, perturbed, disorganized because your period is late? Are you a husband to a woman, to a wife, or to your girlfriend, and her periods have been delayed and you're confused? Listen to the points I'm going to give you. It will determine either you'll have to be patient or see your medical doctor or gynecologist immediately. Let's start. Now, our first point that may delay your periods is exclusive breastfeeding. Now, in so many parts of the world, exclusive breastfeeding is also used as a method of child spacing, what we call lactation amenorrhea method. Because when a baby breastfeeds oftenly, more times in a day, we always tell mothers, let your baby at least breastfeed 8 times a day. In so doing, a hormone called prolactin is released in larger amounts, and in so doing, it will suppress estrogen that helps you have your periods to calm down, and your period may delay. So lactating mothers or breastfeeding mothers, do not worry unless it goes beyond. But for now, you be patient. My next point why your periods may delay that I want to give you is stress. Now, when you have stress, it could be maybe your husband has left you, it could be job stress, it could be any other cause, education, you're fearing exams, you're stressed, your brain. There is what we call a master gland called hypothalamus. We release cortisol, which is a hormone. This cortisol hormone is going to suppress the estrogen hormone that is responsible for producing or assisting in your period to come, and in so doing, your uterus, the basal layer, will not shed off, and your period may delay, you may miss, or you may see them oftenly. Okay, our next point is birth control. Now, in Africa and in the world, there are different types of birth control methods that people use. There are pills, there are implants, there are IUDs. All these ones tend to disturb the body hormones, because remember, these birth control methods, pills or implants, they are already hormones that we introduce in the body to find the hormones that are already there. So in so doing, in exchanging as they are fighting, your hormones will be disturbed, and so it may delay your periods for some time, or the periods may come more often than they wouldn't have been. You may have even to go in your periods twice a month just because of the birth control. So do not get worried. If you went for the artificial family planning method and the doctor advised you to use it, he must have told you this. So do not worry of this. Another point is chronic diseases. Now here I will settle more on diabetes. For the girls who are born with diabetes, diabetes has 2 types. We have diabetes mellitus and diabetes insipidus. Now let's settle more on diabetes mellitus. This one, for children or girls who are born with diabetes mellitus, tend to have late menarche. Menarche is the starting of periods. They tend to delay in starting their periods because of diabetes. And these ones who develop diabetes mellitus as they have grown tend to go into early menopause. Menopause means these ladies now start to have signs of no periods. So if you have a chronic disease like diabetes or celiac disease, you may have a delay in your periods. Therefore, here you have to see your gynecologist. You may not be knowing whether you have diabetes, but some of the signs is you may be sweating all the time, you may be having, your mouth is ever sweet, or you feel tired easily. So when you have such signs, hurriedly please see your doctor as soon as possible. Now, our next point we will talk about is early premenopause. Early premenopause, we mean people who go into menopause at an early age. We know that science has told us, different books say, about the age of 45 to 50 and above. It's when people go into menopause. But you find that people who will go into menopause as early as 40, 38, therefore, you may experience what we call amenorrhea. Amenorrhea is no bleeding, so it may delay, or sometimes you spot. So when you have early menopause, my sister, you may have delayed periods. Another point I want us to talk about is obesity. Now, obesity is, some people may call it overweight, but no, because we have the normal weight, overweight, and then obesity. So obesity, your body tends to produce more of estrogen hormones or estrogen molecules. So if they are more in your body, they tend to delay your periods. So an advice to you, my sister, my mother listening to me, do some exercises. Go see the doctor to tell you how you can cut weight so that you can go back in your normal weight. Because if you have a BMI, body mass index, that is more than 25, my sister, you have to do exercise, because you are in obesity, and therefore you will have problems in delayed period. My next point, similar to that, is low body weight. Now, I have my tiny sisters. In fact, for them, they tend even to take long to go into ovulation, because their bodies produce low levels of estrogen. So if your body produces low levels of estrogen, or more levels or higher levels of estrogen, your body tends to react, and you react by not shedding off. Your uterus may not shed off in the dates you're expected. That's why you find your dates may change. Today you're going to your periods 20th, the next month you're going to your periods 12, the next month 1st. It's because you have a low body weight. So my sister, check your body mass index. See your doctor. If it is lower than the normal, then you'll have to go onto a dietary plan. See a nutritionist in any hospital where you are in a country you're listening in from me. The next point I would also like to talk about is what we call PCOS. Now, PCOS is polycystic ovarian syndrome. This means that some tumors, let's call them cysts, they'll grow into your ovaries, and when they grow there, they tend to grow bigger, and there is a male hormone we call androgen. Androgen, when it is in higher saturation in a woman, it will suppress the estrogen hormone. Remember, in my first video, I told you estrogen is the one that gives you your sweet voice. It gives you your hips, it gives you that body, it gives you the breasts, it gives you that sensation when a man touches you. So androgen will suppress this estrogen, and in so doing, you will have delayed periods when you have PCOS. My advice is see a medical doctor or a gynecologist. He may tell you to do a scan or some tests like hormonal SC, and we will see what next, as according to the medical doctor or gynecologist you have seen. Our next point is thyroid disease. Thyroid disease. Now here I'll talk about two terms. One is hyperthyroidism, and two is hypothyroidism. In science, hyper means high, hypo means low. So hypothyroidism, this means that the thyroid hormones, the T3, the T4, the calcitonin, are produced in lower concentration. Therefore, these hormones, by the way, help us in metabolic rate. So if they're in lower concentration, you'll have low metabolic rate activity, and in so doing, you may have delayed periods. Or hyperthyroidism, it means the thyroid hormones, the T3, the T4, and the calcitonin are produced in higher concentration. So anything that deranges from normal will cause delayed periods, because now hyperthyroidism which means we shall have a higher metabolic rate activity, and therefore your period may be delayed, it may come late or never, meaning you may miss it this month and have it the next month. Then another point I would like to talk about is fibroids. Now, science has told us that fibroids sometimes can be called myomas. In a layman's language, you can call them tumors. These ones develop on your uterus. Women now, I think you know a uterus. It's where your baby grows from. And they are of different types. However, when they come and develop on your uterus. They take control of your uterus. They become the master of your uterus. They deprive your uterus of blood, meaning you will experience what we call amenorrhea. Amenorrhea is no periods. Sometimes people get severe primary or secondary dysmenorrhea. This means pain. Even sometimes people have bleeding during sexual intercourse. Some have dyspareunia. Dyspareunia is painful sexual intercourse. So when we have fibroids on our uteruses, women, I'm talking to you, you may have delayed periods, or sometimes you may go in periods oftenly or spot just because you have fibroids on your uterus. Then lastly, let me talk about this. I know you must have been waiting to listen to this. Pregnancy. Yes, pregnancy can delay, not even delay. You may not see your periods until 9 months are over, because when you're pregnant, it means estrogen is no longer into action, and estrogen is the one responsible to see that you can see your periods this month or the next month. So progesterone takes over, the one we call the policeman of your uterus, because it keeps your pregnancy until you deliver. So if you're pregnant, you may not see your periods until the 9 months are over. Thank you for listening to me. Wherever you are in the different countries, whether you are in Africa or you are in Europe or in the US, I love you so much. I remain your friend Royal Mark. Please, if you haven't subscribed, subscribe. So much is soon coming, is coming every day. We will give you the best. I will make sure I give you the best researched information that is going to help you. Stay tuned for the next video. I love you. God bless you, and bye-bye. Remember, you are never alone.